I'm Dr. Mark Giovanini. I'm the president and CEO of NeuroMicroSpine. I'm a board certified neurosurgeon and I practice in Pensacola, Florida and Destin. Today we're going to talk about SI joint dysfunction. The SI joint is a common joint that causes pain that not many people realize, and it's often overlooked. It's a joint that attaches to the spine via the sacrum from the pelvis. At least 20% of the patients that are sent to me for low back conditions have actually SI joint problems. What these patients complain of is essentially they have hip pain, but it's posterior in the back of the spine, peripheral to the spine or to the side. They walk with a limp or they're walking painfully. Right there, I'm clued into this patient may have SI joint dysfunction. So I'll look at their MRI scan of their lumbar spine. Typically it's almost normal, or it can be abnormal, or they had previous surgery. But if you take the history properly, the patient will tell you they have problems walking, they have problems twisting, and they're pointing right to their SI joint, and that's the Fortin finger sign. And then we do a series of provocative tests that are manipulations of the SI joint. But the real true part to diagnosis is the injection or the diagnostic shot. We need to do a series of injections, and that's at least 3 injections. 2 of the injections will be diagnostic, and it'll prove whether you have SI joint dysfunction. We do a second one just to make sure it wasn't aberrant. And then the third injection is a therapeutic injection with steroid. Once we've identified that you have SI joint dysfunction confidently with the 2 diagnostic injections and then do a therapeutic injection, if the pain comes back, here are the options. 1, you can have another steroid shot. Number 2, you can try radiofrequency ablation. That's where we burn some of the nerves that go to the SI joint. And that's okay for some people, but for those patients that have long-lasting SI joint pain, which are most of the patients I see, then the last option would be SI joint fusion, which I do robotically. I do a CT scan, I make the plan, I construct where I'm going to put the cages that go into the SI joint, and then I exactly perform that with the robot. I do virtually all my patients outpatient. The surgery takes less than an hour, and they're immediately ambulatory, meaning they can walk right out of surgery. I see them back in a month, get an x-ray and see how it looks, and then assess their progress. If we identify them properly, then most of those patients, 90%, will have an excellent result. I can think of a physician that I did that was misdiagnosed for 20 years. He was diagnosed with lumbar dysfunction, or axial low back pain. This guy had the first shot done. Immediate relief of pain. He walked out of my office and had 3 more shots, same thing. He had his SI joint fusion done. He's 50 years old. He's operating. He's doing great. He's running marathons. He's playing in a band. If you feel that you're not heading in the right direction with your diagnosis, we at NeuroMicroSpine have a comprehensive program to identify, completely treat SI joint dysfunction. I'd love to see you in our office with this issue to help you on your road to recovery.